Hello, and welcome to Community Forum. Thank you for tuning in tonight. I'm your host, Dr. Chris Mascetta. If you take your health and well-being as important as I do, or maybe you're somebody who just wants to improve their health a little bit more naturally, you're going to find this show very interesting. I'm here tonight with Dr. Stephanie Sousa, who's a naturopathic physician. And Dr. Sousa is going to talk to us about and explain all about natural medicine tonight and how you can improve your health and well-being more naturally. So, Dr. Sousa, thank you for being here tonight.
Thank you for having me.
Yeah, so I know that you are starting a practice in Ridgefield, Connecticut.
Yes.
Right? And but you're also from the area.
I am from Danbury. I was born and raised here. I went to Danbury High and then even went to WestCon, which is in Danbury.
Excellent.
So yeah.
So you're really local then.
I am.
You did your high school and you did your undergrad.
Yeah.
And what did you study in undergrad?
When I was at WestCon, my major was health promotion exercise sciences. I also did a concentration in wellness management.
Oh, excellent.
And then on the side, I did my pre-med requirements because I knew I wanted to go to medical school.
Excellent.
Yeah.
And so I'd imagine the health promotion and the wellness, is that what led you into the direction of more of a natural as opposed to medical school?
Well, you know, I was already interested in nutrition because my mom was interested in nutrition.
Right.
So when I was in school, I was taking all the courses and I was really enjoying the program. But my nutrition teacher one day said, you know, I wish I'd become a naturopathic doctor. And I was like, oh, you know, I don't know what that is. I need to find out.
Right.
So I did some research, you know, I went online, I looked it up, and then I realized that was really more of what I wanted to do. So I completed the program, but then I tacked on a few extra courses so I could get into the school that I wanted to get into.
Right, right. So when you do your pre-medicine, is it the same as going to medical school?
Yeah, I had to have all the same prereqs that I would have needed for a traditional medical school, and I did play with the idea of going to traditional medical school versus a naturopathic school, but ultimately I felt that naturopathic medicine felt more real to me, more of what I wanted to do.
Right, so it was more part of your philosophy.
Yeah, of course.
And then where did you go to naturopathic college?
So I attended University of Bridgeport College of Naturopathic Medicine, and right now it's the only naturopathic medicine college on the East Coast.
Oh, wow, that's excellent.
Yeah, so
and
that was really convenient.
And it's very convenient that you live in Danbury, able to do all your schooling in Connecticut. And how does naturopathic medical school compare to regular medical school? Is it the same amount of time? Is it the same type of classes?
Yeah, so it was a 4-year program and I needed to complete my bachelor's to attend. And I took all the same courses that a traditional doctor would have. But in addition to all those classes, I had to learn all the alternative therapies. So it was a little bit more intense because we really had to learn a lot more in 4 years.
Right.
In a long, you know, and do an internship at the same time. And but it was great. But yeah, I learned everything that a medical doctor would have.
Right. So you're talking at least 8 years of school.
Yeah.
To become a doctor in naturopathic medicine. So the schooling sounds like it's very intense and very similar.
Yeah.
And did you have to do like an internship or a residency?
Yeah, so I was an intern at the clinic at the school for 2 years. And a residency actually is optional for us. Unfortunately, there aren't enough for everyone to do. So from school, I will be going right into practice.
Right, excellent. Yeah. You must be very excited.
I'm very excited.
And what are some of the differences between like a medical doctor, traditional medical doctor, and a naturopathic doctor? Can you do a lot of the same things?
We can actually do a lot of the same things, but sometimes it depends on what state you're in. So in the state of Connecticut, I don't have the rights to prescribe yet, but we're actually working on that. Right. Hopefully the bill will pass and we'll be able to prescribe. But it's actually, I'm not too upset about that because I think with true naturopathic medicine, we can make do without the pharmaceuticals. Right. But in other states where we're licensed, we are able to do things like IVs or, you know, like B12 shots, or maybe even some minor surgery depending on where you are. So we can do a lot of the same things that a traditional medical doctor can do.
Right, excellent. And what about, are there certain types of diagnostic tests that you can prescribe? Can you prescribe lab work?
Yeah, we can do the conventional lab work, you know, whether you want to get something like for your thyroid tested or maybe your cholesterol levels tested. We can even order some imaging, like if you need to get like an x-ray done, we can order that. But I also do a lot of alternative testing too, which I think sets me apart a little bit from the medical doctors. I do a lot of food sensitivity testing. I can do some hair analysis, blood typing. It's all very important things to help the person to heal.
Oh, that sounds very interesting. So you
Yeah.
may do the traditional tests that your primary care doctor might prescribe,
Yeah.
but it sounds like you may get a little bit more specific with your testing.
Yeah, a lot of the conventional tests I think are really important to help diagnose a person, but I think there's other tests out there that don't get enough credit and can really give us a lot of information about the patient and really personalize their protocol treatment.
Right. And I would think that with the type of medicine that you do, is it more holistic? You know, when you go to a specialist, they're always a specialist for this or a specialist for that.
Yeah.
Are you looking really more at the entire system and body?
Yeah, with naturopathic medicine, we always try to look at the whole body because everything is related. So you might come in with a problem up here, but we're looking at something down here.
Right.
But it's all connected because the body works together. It doesn't, you know, there's different systems, yes, and it's important to know about each system, but we also have to know how each system works together, and that's how we can.
Because one part of the body can cause symptoms in a completely other part of the body, and you might be looking at a lung, but maybe there's something else going on deeper.
Yes.
And it's just showing up through the lungs or the pulmonary system. Well, that brings me to who would benefit seeing a naturopathic physician? Are you working with younger people or older people or in between?
Actually, everyone can come see a naturopathic physician. I think we have a lot to offer to all sorts of populations, whether it is children or the elderly, adults, even if you're pregnant. I think there's something to offer for everyone.
Right, right, excellent. And what kind of, are there specific conditions that you work with, or what types of things would benefit benefit the most from naturopathic medicine?
Well, I was trained to diagnose acute conditions and chronic conditions. So really, we can treat anything from like the common cold to diabetes, and anything in between. Anything really.
Do a lot of people come to you before seeing their regular medical doctor? Or is a lot of people who maybe have gone through the medical system and haven't gotten the results that they want?
So I feel that most of the people that come to see naturopathic doctors, they've already gone through the conventional system and they didn't get the results that they were looking for, and oftentimes we're the last resort. They're like, okay, I'll try this out, I'll see if it works. They've already tried everything. But there are some people that actually use naturopathic physicians as their go-to before turning to the conventional. And it's great to see that we're seeing people starting to shift the way they think about medicine and healthcare, and I like that.
Yeah, I think that the whole, hopefully the country is shifting more towards natural ways. Certainly in this part of the country, the Northeast, I think it's becoming a lot more popular. I'm a chiropractor, so we see a lot of inflammation, obviously, in my practice. People have injuries and they're in pain, and most of the time, it's because of inflammation within the body. But I also understand that inflammation is a big part of your overall health and well-being.
Yeah.
And a lot of, chronic illnesses or, what I call lifestyle diseases are inflammatory based.
They are.
Is that a lot of what you would see?
I do see a lot of people who do have inflammation that they don't even realize. People with like migraines or even like thyroid problems or obesity. It's all related to inflammation, and they're doing something. They probably don't know what it is. Maybe it's something they're eating or just something part of their lifestyle that's causing this inflammation. So we do try to work on that. Try to get at what caused the inflammation, not necessarily just getting rid of the inflammation, because that's not really solving the problem.
Right, because then it's just treating the symptom.
Right, and
so you want to get more to the core, and I guess that's probably the big difference of what naturopathic is trying to find the cause of the symptom.
Right.
Because a lot of times I think people get confused, especially when they see me, they come in with a symptom and they think that's the problem.
Right.
And as a chiropractor, what we're trying to do is look and find what's really causing that symptom. And it's very similar to what you would do, I would think.
Yeah, actually, in the naturopathic philosophy, when someone comes in with like a pain, maybe they have a pain in their back, that's the body's response to something that's going on in the body. Right. So we actually have to look at this response and try to interpret and say, okay, what is this trying to tell us, and what are we supposed to do with it?
Right.
Not necessarily just kind of block the signal that's going there.
Right.
And I think it's important to realize that.
Right, and that's probably a lot of what medicine does. Medicine changes what's called the autonomic nervous system, right, to get a result where you're probably more encouraging the natural healing ability of the body.
Right, because sometimes something will happen and the natural response is to create some inflammation, but sometimes you don't want to cut that off, and we want to actually enhance that to help the body to heal it. Yeah. So it depends on what's going on.
You know what, I see that every day in my office where people just, the pain is actually a sign that the body is working correctly. And it's telling us there's something wrong.
Right.
And we want to manage the pain, but we also want to respect the pain and let it do its thing and manage the best we can.
Right.
You hear a lot about the anti-inflammatory lifestyle, or reducing inflammation in your body. And actually, one of the reasons I use naturopaths a lot, I refer to a lot of different doctors in the area, and naturopaths are probably one of my favorites to refer to, because a lot of times that the pain I'm seeing, it may not necessarily be just mechanical, but there may be another underlying cause. And I do some nutrition within my practice, but it's nice to utilize an expert like yourself to help manage, because a lot of times when they're not getting better, there's something else going on. Maybe it's nutritional, or maybe something's out of balance, and somebody like you would be somebody great to treat that patient. But I talk a lot about my patients of ways to reduce the inflammation in the lifestyle. Are there any suggestions that you could recommend as far as reducing inflammation?
Yeah, I mean, there's a lot that can be done, but usually I try to start with the basics, and that's really just changing the diet.
Right.
We want to focus on increasing vegetables and getting rid of all the processed food. That's what's really causing a lot of the inflammation.
Right. Which is probably the hardest thing for patients to do.
It can be really hard. Some people are okay doing diet overhauls, some people are not. But little by little, okay, I work with people. I try to meet them where they're at, and try to help them to progress without being too harsh. But yeah, trying to increase as many vegetables as you can in the diet, and with some fruits, that's okay too, because that's really going to have a lot of anti-inflammatory propriety and prevent more inflammation from coming about.
Right.
But then also, being physically active, getting a good night's rest, drinking proper water, that will also help to keep inflammation down.
Right. And that's not only going to help with pain, but things like cardiovascular disease, right? Diabetes, obesity.
Yeah.
And the list really goes
all the chronic conditions,
on and on. I'd imagine, you hear a lot about gluten, like gluten-based foods. Would they be more inflammatory than some of the others, whether you have like a sensitivity to it or not? Or?
I've seen a lot of people, especially in the last couple of years, start going gluten-free, which in one sense is great. They're getting away from a lot of pro-inflammatory carbs, but unfortunately what I'm actually seeing is people buying gluten-free bagels and gluten-free muffins, and that's not really anti-inflammatory, that's not really healthy.
Right, I was going to say, just because, and that's important I think for the viewers to really understand, just because it says gluten-free, or just because it says it's natural, it may not necessarily is.
And there are definitely a certain population of people that are very sensitive to wheat and cannot have it. That's the celiac, people with celiac disease. And then you do have some people that actually do not have celiac disease, but they're actually sensitive to wheat, and they notice that when they stop eating it, they feel better, even though maybe lab tests might show that they don't have celiac. Right. So it's definitely a food to try to eliminate if you can, but I wouldn't replace it with gluten-free grains. I would try to just eat more fruits and vegetables, and maybe some decent quality protein, and be gluten-free in that sense, or more grain-free in that sense.
Right, because I think it's probably it is a healthy way to eat. Not necessarily cut it all out, but try to eat more intelligently, like lean meats, so things like chicken and lean beef and fish and things like that. And then vegetables, non-starchy vegetables probably, a lot more of the greens. And fruits. And there's a lot of fiber in fruit and whatnot. So I think that basically sums up the anti-inflammatory.
Pretty much.
And then, so a lot of the ones that are refined sugars, refined wheat flours, processed foods, you want to maybe avoid a lot of that stuff?
Of course, as much as you can. If you can avoid anything really that's white, the sugar, rice, potato flour, tapioca flour, there's all these things out there that people are using. They're getting all creative, and they're making these gluten-free desserts, but it's still, loaded with carbs, and it's still very inflammatory. So people just got to be careful with that. I would stick to, whatever came out of the ground, or off the ground.
Right.
If it lived on the ground, maybe in the water.
Right. Excellent. So. That's very good. Sometimes people are worried about fish because of contaminants, like, mercury and things like that. But if you're getting really high quality fish from ocean water, like open waters, cold fish.
Yeah, you do want to be careful with which fishes you're eating. Some of them can be higher in certain toxicities, so you do want to be careful with that. But usually the smaller fishes are okay.
Right.
Yeah.
Excellent. So, I also see there's a lot of issues with gastrointestinal issues and problems, and I treat some of that in the office as well when it comes up. But and I know there's a lot, it's a large array of different conditions, but being that it's such a large part of the population, do you see a lot of those types of things in your in practice?
Yeah, actually, I felt like a good part of the patients that I saw when I was doing my internship had either IBS or IBD or some other kind of gastro thing going on, maybe like some GERD or which is just reflux.
And what is IBS? That's like irritable bowel?
Irritable bowel syndrome or irritable bowel disease, which is Crohn's disease or ulcerative colitis, which is a little bit more severe.
So they're all a little bit different. Yeah. Do they kind of progress one into the other?
Not necessarily, but you could have a little bit of both depending on what's going on. But yeah, I do see a lot of people with gastrointestinal issues, and there's a lot that naturopathic medicine can do for them, and not only just changing the diet. I mean, I'm always coming back to that, gotta get some more fruits and vegetables in there, gotta get rid of all the junk food as much as you can. But there's also certain nutrients that can help the gut to heal, specifically for the small intestine and then for the large intestine, depending on what's going on. So it's important to address those, find out what the body is lacking and replace that.
Right, and a lot of it, I guess, does go back to chronic inflammation in the body. First off, cutting out the foods that may be more inflammatory, eating more naturally and sensibly. What about like enzymes? Is it a lot? I know a lot of the foods today, they're genetically modified, and a lot of the genetic. You correct me if I'm not right, but is taking a lot of the enzymes out, so that it is longer shelf life. So is it important to eat really good quality like fruits and vegetables when you have a gastrointestinal problem that has more enzymes to help with the digestion?
Yeah, so the genetically modifying foods does definitely change the food and the way it was to whatever it is now, and the body doesn't recognize that very well, so that can definitely lead to an inflammatory response, which we don't want, and it does alter the properties of the actual plant. So it is important to choose things that are organic and non-GMO if possible. I know some people don't like that they're a little bit more pricey, but it's definitely worth it because in the long run.
Right. Because you're going to be healthier for it.
Exactly.
You'll be paying less medical bills.
Right. So, but if you're eating these foods in their raw form, you're actually going to get more enzymes from it than versus the cooked forms.
Right.
Yeah.
Right. Because if you're cooking it, you're kind of depleting some of that.
Right.
Excellent. And then, would you recommend a certain supplement program? What kind of are there certain supplements that you would treat certain things with? As far as the GI issues?
Yeah, I mean, it depends on what's going on. So if someone were to have IBS or IBD, I might focus more on treating the large intestine, and I would want to make sure that they're on some butyric acid, because that's like food for the cells that are there. If they had maybe some small intestine bacterial overgrowth, or what we call SIBO, then I might want to treat the small intestine, maybe add some glutamine in there or some probiotics to try to restore the function of the gut there. But we also have to remove anything that's causing the inflammation, so that comes back down to what you were eating again.
Right.
And actually, there's even sometimes people don't even know they're eating something that they're sensitive to, but they don't even know it. It might be like an apple or something, So, sometimes I'll do elimination diets with my patients, because that's the only true way to really know what the patient is sensitive to.
Right.
Take them all this stuff, and then we introduce it slowly, and then a lot of times they'll find these offending foods that they didn't even know were really bothering them. They thought they were healthy.
Right.
So it's important to look at all aspects of it.
And then in some of your investigation with lab testing.
Yeah,
too. You can do sensitivity testing.
Yeah.
I do some of that in the office.
Yeah, it is. Sometimes people don't like
panels.
to do. Yeah, sometimes people don't like to go through the elimination diet part. So we'll do the food sensitivity test.
It's a little bit quicker and accurate as well.
Yeah, some of them are very accurate, and people notice, they came off of this stuff and they feel so much better, which is great to see. Yeah.
And sensitivities doesn't necessarily mean allergy.
No.
But it may lead to an allergy.
It may, depending on what it is. I mean, a true allergy, people generally know to stay away from that. Their throat might start closing up, they'll get hives, they'll turn red. Right. That's a true allergy. But I'm talking about a food sensitivity, something you may have something on Sunday and not even see a reaction until Tuesday.
Right.
So those are it's more like a delayed reaction. And so a lot of times people don't even know they have them because they're constantly eating the food. So it's important to detect those.
Right. Yeah. Now, we discussed, what my next question was going to be, and that's really about allergies and food sensitivities, because, especially in kids today, I have an 11-year-old and a 15-year-old, and it's amazing to me how many food sensitivities there are.
Yeah.
Peanut sensitivities and nut allergies and all these different things that weren't there, that when I was a child, certainly. So those are things that you would probably, it sounds as if from the conversation we just had, that you would see as well, and would probably benefit from naturopathic. Yeah, and there are, sometimes you can outgrow certain sensitivities. I don't know about
true allergies. But if we work on treating the gut, we can definitely repair the lining there and help to so that when the person is eating these foods, it's not as reactive, so you get a much normal response to certain foods, but it takes some work.
So they could tolerate a little bit more.
Yeah.
Right, and that's the thing with naturopathic medicine. It's, in medicine, I think people really expect a quick outcome. But naturopathic, in natural ways, it's more long-term goals, I would think.
Yeah, it does take a little bit more time, but it's truly effective in the long run. I mean, maybe you don't get a response right now, but I think as you start to see the change over time, it'll stay with you much longer than something that just worked in the instant, that really just covered it up and didn't, get to the problem.
Yeah, it's really not getting to the source of the problem.
So it's constantly going to keep coming, even though, so.
I always explain on the first visit with my patients that I'm not only treating them now, but I'm treating who they're going to become in 20, 30, 40 years. I tell people I want you to be in your 90s playing with your great-grandchildren.
Yes.
Not in a nursing home somewhere or in a wheelchair. But that's what it sounds like. It's really true health and changing lifestyle, finding where there may be some underlying problems and correcting them.
Yep.
As naturally as possible. And it's not that you're necessarily opposed to medication, but just when it's necessary.
There's always a time and place for it. But sometimes it's not always needed. I think there's a lot of alternative things that we can do, and I think medication should be the last resort.
Right, yeah, I agree with you. What would you, well actually, you know what I want to talk about, because, heading into the winter, right? What, do you see a lot of cold and flus? Is there any recommendations that you might give for people to just generally stay healthy? I'm not necessarily see a naturopath for it, but are there certain ways to kind of get through the cold and flu season more naturally?
Yeah, I mean, there's you want to stay properly hydrated. Oftentimes people get a little dehydrated in the winter. That's
actually great advice, especially with the heat coming on.
Yeah, it's kind of ironic. People think you get dehydrated in the summer, but it's actually more in the winter. So you want to stay properly hydrated and actually get good quality sleep. The more rested you are, the better your body can function during the day. You also, of course, you want to eat properly. Get your vegetables. Have a vegetable, at every meal.
Keeps coming back to the vegetables and lean meats and good proteins.
They must be really good. And then, I mean, there's, you want to make sure you're taking maybe a good multivitamin to make sure your body's getting all these good nutrients, make sure vitamin D is adequate. You got to get that level tested to see, what your level is at, and make sure it's going to be good enough to last you through the winter, because there's not as much sun right now, and we're not as outside as often. It's not really easy to absorb at this time of the year anyway. Right. So you want to do stuff like that. But there's also you can have a little bit more green teas, or some elderberry syrup. That might be some really nice.
My kids love elderberry syrup. Especially this time of the year.
There's really good properties that are good for colds. So
that kind of brings me to supplements. Are there differences in the quality of supplements?
Yes.
Yeah, so, getting something at like one of these box stores may not be the same as what you might carry.
Yeah,
or recommend, I should say.
Yeah, so I know people like to go to their local drugstore or their convenience store, whatever it is, and they see supplements, it's half off. Well, half off means half quality.
Right, that's a great way to put it.
There was a great article that ran in the New York Times and the Washington Post a couple of years ago that investigated a couple of different retailers and to see what was actually in their supplements, and they found out that actually what was on the label was really not what was in the bottle.
Wow.
And it was just a lot of fillers, and if it actually did have like the herb or the vitamin, it was actually very low and really wasn't going to do much. So people are spending lots of money on supplements and they're not really doing anything.
What they're looking.
And then people complain that it didn't work. Read
that's
something
what I was
online.
Say, yeah.
So it's really important to try to get professional grade supplements, or maybe even go to like your local health food store. That generally is okay, but you don't really want to buy anything online. You don't know where it came from. You don't know if someone just put label on the bottle and just stuff something in there.
Right.
So you really want to be careful about what you're buying. If you buy the professional grade products, which you can get from a doctor, naturopath, chiropractor, wherever.
And professional grade products mean that it's supplements that are sold through a professional, like a chiropractor, medical doctor, naturopathic
Generally,
doctor.
Yeah, you can only get them through the through your doctor.
So it's a much higher grade than what you're going to find elsewhere.
Yeah, but you're pretty much guaranteed that what's in the bottle is what you're going to get, and then you will know like how much of the active substance is in there, so then you know how to properly dose that and how it will act in your body, and that's really important. You know, if people are going to be investing in supplements and into their health, then you want to make sure you're getting what you're paid for.
Right, and there's a lot of combinations. You need a certain ratio of balance between one nutrient and the other for absorption, and maybe the lesser quality may not have that.
Yeah, and oftentimes the lesser quality supplements, the ones that you find at the convenience stores, don't use the active forms of the vitamins. So yeah, there might be some vitamins in there, but the body doesn't recognize it properly. So the body just kind of just gets rid of it, or maybe it stores it.
Bedpan bullets.
Right. So it's not really doing you much. So you want to make sure you're also getting the active forms of the vitamins and the minerals. So.
And I'd imagine also the way it breaks down in the body.
Yeah, there's some supplements that don't even break down because they're just
too
so
compacted.
Yeah, and they're all filled with synthetic fillers. The body doesn't even know what to do with it. It just kind of gets released, and that's it.
Do you have any advice of what people should look for, like if they're out shopping for supplements? And that's usually what I recommend is, like the box stores, convenience stores, probably the lower quality, then natural food stores, and then more the supplement, the professional grade supplements, or the higher quality. But is there something they should look for to know that's not as good as maybe something else?
I would look at the ingredient labels and look, does it have food dyes in there? Does it have maybe some strange sounding fillers? Like, can you recognize what's in there? You should be able to read it all and know what it is. And then also do a little bit of research, like vitamin E oftentimes is in supplements, like in a multi, and oftentimes they'll use the synthetic form, and we know it's synthetic because it says DL alpha tocopherol. So so you want to get that, it says D alpha tocopherol, so you want to be careful with that.
And that's what somebody seeing like you'll let them know.
Yeah, I try to tell all my patients to look for stuff like this, or even like folate. A lot of times folic acid is in the multivitamin, but the active form is folate, and more people oftentimes need the active form of the folate to really utilize it properly in the body. So you want to look for things like that.
Well, we're running out of time. We have just about a minute left. What could somebody expect, quickly when they would to see you as far as for an appointment? Yeah,
well, when you come in for a first visit, it can run anywhere between 45 minutes to an hour, maybe an hour and a half, depending on how complex your case is. But we take a very thorough history, and that's really important to know every aspect of the person so that we can, create a personalized protocol for that person, because not everyone gets the same thing.
Right.
And then, when you come back for a return, it's about 30 minutes as well.
Excellent. So if anybody wanted to contact you, how would they go about that? Where are you located?
I'm going to be at 10 South Street in Ridgefield, Connecticut.
Okay, in Ridgefield, Connecticut. Yeah. Excellent. So they could look you up as Dr. Stephanie de Sousa, and if they have any questions, they can call?
Yeah.
Okay, excellent. Is there anything else you'd like to add?
Well, if you always keep doing what you've always done, you'll always get what you've always gotten. So
it's time to change.
It's time to change.
Excellent. Well, thank you so much for joining us. And I want to thank you for tuning in to Community Forum. I'm Dr. Chris Mascetta with Dr. Stephanie de Sousa. Thank you so much for tuning in, and we'll see you next time.